Hi, my name is Sarah Song. I'm a biochemistry and nutrition major at the University of Texas. Today I'm going to share with you just a little bit about anxiety disorders. So the first question we come upon is, what is anxiety? Anxiety is defined as excessive, irrational fear, worry, or dread. This is not your typical worry over a test or temporary fear. Um, this is an extended period of excessive, irrational feelings and emotions. So then we come across the question, what is anxiety disorder? Anxiety disorder is actually a group of common psychiatric disorders, all of which share a feature of excessive fear and anxiety and the related behavioral disturbances along with them. So there are a multitude of anxiety disorders. There's general anxiety disorder, as well as panic disorder, social anxiety disorder, separation anxiety disorder, selective mutism, and agoraphobia. So, how does anxiety disorders, how do they look like in the United States? In the United States, social anxiety disorder is the most common, with an estimated rate of almost 10%. Followed by generalized anxiety disorder, which might be the most commonly known, and then panic disorder. Um, it is generally more common in females by just a small bit, as well as the younger population, adolescents, young adults. In fact, the onset of social anxiety disorder can be as early as 11 years old. Um, there have not been any differences in rates of anxiety disorders among Caucasians, African Americans, or Hispanics within the United States as of now. So, what are the causes of anxiety disorders? Anxiety disorders are attributed with a multitude of factors that lead up to the onset of the disorder. This includes a genetic component. In fact, twin studies have been done that have proved there is a genetic predisposition to anxiety disorders. However, at the moment, we have not found any single gene that we can accredit it to. Along with the genetic component, there is an environmental one that um, oftentimes things like trauma or other major events that happen in our lives can affect the way that we react to trauma and stress, and um, can lead to the onset of a disorder like an anxiety disorder, especially if the trauma happened earlier on in childhood. So, what does anxiety disorder look like? What are the symptoms of it? Well, as I said earlier, there are a multitude of disorders within the family of anxiety disorders. But the major symptom that goes across the entire board is increased anxiety, severe anxiety. Um, and of course, like we were saying earlier, this is intense, irrational, unexplainable fear, worry, dread over things that are often over things that should not elicit that kind of response. Um, Another sign that you could look for anxiety disorders, they commonly occur along with other mental or physical illnesses, including depression, Parkinson's, or alcohol or substance abuse. In fact, a lot of times um, these other disorders are the cause of the onset of anxiety disorder, or vice versa. Um, and each anxiety disorder on its own, generalized or panic or social anxiety disorder, all of these have additional specific symptoms of their own. To delve in just briefly into panic disorder, which is probably one of the most well known. Everyone knows of the term anxiety attacks, but what does that mean, and what kind of disorder are they associated with? Well, in fact, anxiety attacks are not common among all the family of disorders. They Panic disorders are the specified disorder that covers those symptoms of panic attacks. These panic attacks, they're sudden onsets of fear or discomfort. Um, these panic attacks reach a peak within 10 minutes, and it's a extreme arousal of the sympathetic nervous system. So things like your heart will pound, your heart rate will go up, you will sweat, you might shake or tremble, it might be hard for you to breathe, or in fact, it might feel like you physically just cannot breathe. It could lead to chest pain, dizziness, unsteadiness, as well as other emotions of derealization, which means what's happening to you does not feel real, or depersonalization, as in it doesn't feel like it's happening to you. Maybe it looks more like you're watching it happen to you. As well as a fear of losing control or going crazy, a fear of dying. All of these emotions attack you all at once, and that is what we classify a panic attack as. So, what is going on neurologically, psychologically, biologically that could cause anxiety disorder like this? What is the etiology behind it? Well, the amygdala is a part of the brain that has been most attributed for fear and anxiety. In fact, it's one of the known reflexes that we are born with as infants, that when you hear a loud sound, um, you automatically clench your neck and flinch away oftentimes, and that has been linked back to a response in the amygdala. And patients with anxiety disorder show heightened responses in the amygdala when anxiety stimuli when they stumble across stimuli that brings them anxiety. In addition, recently there have been a lot of studies that have shown that abnormalities in the hypothalamus are common among anxiety patients instead of the amygdala, which is something new and something that people are still breaking the ground in. As for the pathophysiology, what is going on in your brain, in the central nervous system, the neurotransmitters that have been linked with anxiety disorder have been GABA, norepinephrine, serotonin, and dopamine. And what they have seen is they've seen increased activity in the parahippocampal gyrus, as well as for panic disorders, they've seen a decreased activity in the anterior temporal cortex and the amygdala, which is not something you would expect. But patients in general with anxiety disorder have been found to have abnormalities in their amygdala. And all of these things that are going on in their brain elicit the kind of symptoms that we see with anxiety disorders. So, what is the treatment for anxiety disorders? Is there one? Can we treat this disease? The answer is yes. Psychotherapy is very, very much recommended. In fact, it is not recommended to just take medicine for this disorder without having psychotherapy on the side as well. The psychotherapy that is used is cognitive behavioral therapy. So it has two parts, the cognitive and the behavioral side. The cognitive therapy part is to help you understand the kind of thoughts that you're having and be able to differentiate between these normal, healthy thoughts and these abnormal, anxious ones, and to have that extra clarity within your brain so that you're able to understand exactly what's going on and make rational sense of it. And then behavioral therapy, on the other hand, is to um, build you up and give you a lot of exposure to these kind of anxiety provoking stimuli so that you are able to build up these skills so that you can deal with anxiety on your own. Whether that might be learning how to deal with panic attacks or learning how to just function in everyday life with like generalized anxiety disorder. Um, that is what behavioral therapy aims to go at. In cognitive behavioral therapy, it can be used alone. In fact, oftentimes it is used alone without any medicine, but that's not vice versa. With pharmacotherapy should not be used alone. But if you combine psychotherapy and pharmacotherapy, it has been proven to have the best results. So, on the other hand, what kind of medicine can you take? The first drug of choice when it comes to anxiety disorder are actually antidepressants. Um, these the one I have written here would be selective serotonin reuptake inhibitors, mainly because that is one of the newer antidepressants and it has reached a lot of hype, right? It's what Prozac is made of. So selective serotonin reuptake inhibitors, they increase the amount of serotonin within the synapses of neurons by inhibiting them from being reabsorbed by the presynaptic neuron. This allows the serotonin to stay in the synaptic cleft and have more opportunity to bind to the postsynaptic receptor. And of course, serotonin is a neurotransmitter that is known to help relax, as well as it's known as the happy drug. SSRIs are also used to treat OCD as well as depression. And this works very well because oftentimes anxiety disorders are found hand in hand in patients with depression or patients who are suffering with other mental illnesses. So SSRIs become beneficial in many reasons and many factors. The exact anti-anxiety drug that has been found, though, they're called anxiolytic drugs. The most common one is benzodiazepines. It is not found to be very effective to use just an anti-anxiety drug without antidepressants as well as psychotherapy. But you have probably heard of these anti-anxiety drugs. It's Valium, Librium, and Xanax. So how does benzodiazepines work? How do they work? One of the neurotransmitters we were talking about earlier that is involved with anxiety disorders, GABA, it is an inhibitory neurotransmitter in the central nervous system. What GABA does, it binds to GABA receptors, and this GABA receptor, as you can see, it has these GABA receptors are an ion channel, a chloride ion channel. And when GABA receptors bind to this channel, it allows chloride ions to enter the cell. When they enter the neuron, since chloride ions are negative, it hyperpolarizes the cell, meaning it makes the cell more negative. If you remember back to your neurobiology, in order for neurons to fire an action potential, they need to be depolarized. Oh, making it less negative. They need to be depolarized, right? To reach that threshold. But by hyperpolarizing the cell, it makes it harder and less responsive for other excitatory neurotransmitters to depolarize the cell enough for an action potential. So in that way, it has a sedative, tranquilizing effect on the brain. So what benzodiazepines do in that gamma receptor, there are 4 subunits that surround this channel. So you can see the ion channel in blue there, and you see the 4 subunits surrounding it in yellow. Benzodiazepines, they bind to 3 of those subunits on a GABA A receptor. So there are GABA A, there's GABA B. They bind to a GABA A receptor. This does not open or close the channel, but it does twist the receptor so that GABA can bind more easily to the receptor. So in essence, it is just helping GABA inhibit the neuron from being from reaching its action potential, right? So it facilitates the effects of GABA, which are sedative. So since we're playing on the sedative action of GABA, it allows us to calm the patient down when they are experiencing overactive psychological response in the amygdala, the hypothalamus, the midbrain, and other regions in the brain, which is common among panic disorders as well as anxiety disorders. And last but not least, what is the prognosis? So if you do the pharmacotherapy and you do the psychotherapy and you are seeking professional help, the prognosis of you recovering or learning how to deal and manage your anxiety symptoms is very, very good. The majority of patients are able to reduce or eliminate their symptoms after several months of psychotherapy. This being said, if you leave the disorder untreated, however, remember anxiety disorders, they're often found along with other mental disorders like depression, OCD, substance abuse. The rates of suicide are very high if you leave them untreated, as well as the risk of overdosing. So definitely, we need to get help for these patients because anxiety disorder is something that can be very well managed and controlled as long as professional help is sought. This is important because even among college students these days, the anxiety disorders and the prevalence of them are on the rise. Even at UT campus, we have a counseling and mental health service in the student services building, and the number of visits there this year has been higher than ever before. And students are dealing with so much more stress and pressure that they more commonly report feelings of anxiety and feelings of complete overwhelmness. So it's important that people are aware of what's going on and people are aware of this disorder that can be treated for and can really be accounted for. And yeah, if you would like more information, the references and where I got this information was Medscape, the National Institute for Mental Health, and the American Psychological Association. Thank you so very much.